Mr. Mark Reid has reported that the FDA toxicologist, Dr. Owen McMaster, criticised your claims during this process. Tafenoquine was ultimately approved by the FDA. So what is your view on how your evidence was viewed, and were you a lone voice in this argument?
So I would remind Mr. Reid that every drug that has been withdrawn for safety reasons was once declared safe and effective by the Food and Drug Administration. So the FDA has a very poor track record of predicting the ultimate safety profile of drugs that it approves. And of course, tafenoquine for prophylaxis received very troublingly 4 votes against its safety. Many members of the committee were not impressed at all by the evidence that 60 Degrees Pharmaceuticals presented in support of the safety of the drug. And the chairman, Dr. Dow, made it very clear that his company did not want to see any warnings of neuropsychiatric effects on the tafenoquine label, because this would adversely affect the marketability of the drug. And yet, despite what the FDA toxicologist has concluded, the FDA nonetheless has decided that it was critical to include neuropsychiatric warnings on the tafenoquine label for prophylaxis. And these warnings make it clear that the FDA, I think, is worried about the same liability to neuropsychiatric adverse effects that has been demonstrated with Mefloquine.